How does trauma and stress affect the adolescent brain? Presented by Carolyn Jean Taylor. Although necessary for survival, chronic and frequent physiological stress response can alter brain development, leading to dysregulation of neural circuitry. Children exposed to traumatic stress may develop post-traumatic stress disorder, PTSD. Exposure to high levels of stress can affect brain system, hormonal system, epigenetics, the way our DNA is read and transcribed, cause disease, and lower life expectancy. Children who experience adversity at an early age are more likely to exhibit deficits in executive functioning, suggesting that these capacities are vulnerable to disruption early in the developmental process. ACEs, or adverse childhood experiences, toxic stress, poverty, drug addiction, hunger, child maltreatment, abuse, divorce, mental illness, unemployment, neglect, death of a parent, emotional abuse, parent incarceration, witnessing domestic violence, exposure to violence can all affect healthy brain development. Brain development begins in the prenatal period and undergoes rapid growth in the first years of life. During this sensitive period, the brain is most susceptible to negative influences. Prenatal stress exposure is extremely damaging to the fetus and is associated with emotional and behavioral disturbances in infancy and childhood. Stress-related symptoms in pregnancy are risk factors for neurobehavioral disorders. 10 to 35% of children worldwide, nearly 8 to 23% of infants in the United States, or almost 800,000 neonates yearly, experience prenatal exposure to depression and stress. Danger, anxiety, fear, fight, or flight. The prefrontal cortex, amygdala, and hippocampus are areas in the brain most affected by traumatic stress. Overactivation of the body's stress response system, causing release in stress hormones cortisol and adrenaline, can become maladaptive and health damaging over time. These are just some protective factors for resiliency, opportunities for engagement within school and community, good coping skills and problem solving skills, motivation to succeed, communication skills, supportive relationships with family members, emotional self regulation, high self esteem, family, friends, mentors. Let's be a protective factor in the life of a youth and help build a healthy brain. Thank you for watching.